Okay, so we're going to talk some more about fluid therapy. Right now we're going to talk about a healthy adult. And in a healthy adult animal, about 60% of their body weight is water. And then in neonates, about 80% of their body weight is water. So this is why neonates can become dehydrated more quickly, because they need more water throughout their body. And basically what we do is we determine how their hydration status is, and we base that on a few things. The patient history, so what the owner tells us, the physical exam, okay, and then urine production. So in a healthy animal, fluid intake is what we would consider, we would get fluid intake from food, water, and as well as metabolism. Canines take in about 50 to 100 mLs of fluid per kg per day, and then felines are about 40 to 70 mLs per kg per day. So this is about how much water and fluid intake that they make. Then we determine fluid loss, and fluid loss would be considered urine. We lose fluid in stool, and we also lose fluid through our skin and respiration. It's important to remember that fluid loss comes from stool, because if an animal has diarrhea, they're losing fluid that way, more so than they would if it was a regular normal stool. So our kidneys are our primary regulator, and in a healthy animal, the more fluid they take in, the more fluid that's going to come out. And so if they are taking in less fluid, then less fluids will come out. And this is how we can see on specific gravity if they are, one of the reasons why we can see if they're dehydrated or not. So let's talk about dehydration. So basically, dehydration is a condition that arises when excessive amounts of body water are lost. And so basically what happens, the water within the interstitial space, or in the intracellular space, it moves into the extracellular space. Okay, so there's different types of dehydration. One is hypotonic dehydration, and this you would see in chronic heart failure. And this is when they have loss of fluid and low concentration of dissolved particles. Okay. Then there's hypertonic dehydration, and this is with loss of fluids and a greater amount in solutes, and we get this from heat stroke. So we saw a lot of hypertonic dehydration in Las Vegas. Because it's hot, we would get a lot of animals with heat stroke. You could also get hypertonic dehydration with excessive exercise. And then isotonic dehydration, this is when the solute concentration remains equal. So they lose equal amount through both spaces. And we see this a lot of times in vomiting and diarrhea. You could also see this with hemorrhagic shock. Another type of dehydration and things that we need fluids for, the biggest one would be hypovolemia. And hypovolemia is a drop in the volume of blood within the vasculature. And also, it's if you think about it a little differently, it's the loss of blood plasma and or blood from the intravascular space. And we see these in things like trauma, so an acute car accident with a lot of internal bleeding, acute disease like a GDV, when the stomach twists on itself, that definitely causes some hypovolemia, as well as a prolonged illness can cause some hypovolemia. So basically what the patient experiences is a decrease in cardiac output and a decrease in blood pressure. So fluid loss that involves a greater proportion of solute causes movement of of water from the extracellular space and into the intracellular compartment. So hypovolemia is something that definitely needs to be treated immediately, and it's treated with using fluids. So let's talk about hydration and volume status. How do you know if a patient is dehydrated or if they are hypovolemic? Well, The first thing is we can do our physical exam. So in our physical exam, a normal patient, we would see a skin tent about 1 to 2 seconds. And there's a video that you're also going to watch that's about MAF, and we go a little bit deeper into this. Their mucous membrane will be moist, their eyes will appear normal, and their cap refill time will be about 1 second. Okay, 7 to 9% dehydrated, they're going to have a delay in their skin tent, so when you lift it up, it won't pop back down as quickly. It's noticeably dry mucous membranes. Their eyes may appear dry, the cornea. And they have a, they have a longer cap refill time of 3 seconds. So let's go back up here to 5 to 6%. They have a slight delay in their skin tent. They have tacky mucous membrane. Their eyes appear normal, and their cap refill time could be about 1 to 2 seconds, and they're pink. Okay. And moving, so we talked about 7 to 9% being delayed, skin tent, noticeably dry mucous membrane, their eyes appear dry, and they have a cap refill time of about 3 seconds. 10 to 12 seconds, or 10 to 12%, this is skin tent remains tented, their mucous membranes are dry, they have sunken eyes, and they have about a greater than 3 second cap refill time. Their mucous membranes may also appear pale at this point. A patient that is greater than 12%, the skin tent remains, they have dry mucous membranes, sunken eyes, they have an extremely slow, if any, cap refill time present. They're going to be pale, their pulse is going to be weak and thready. You need to know that at 12%, death is imminent. So there's some tests that we can also do, some diagnostic tests we can do that can see if a patient is dehydrated. So Pcv and total solids, or TP, total protein, you can say either one, they're interchangeable. If you have a higher Pcv and a higher total solids, this constitutes water loss, H2O loss, and this comes from like vomiting or diarrhea from a patient. If you run your Pcv and it's higher than normal, you're considered that's water loss, but there is loss of protein, so you have a lower total solids. They're losing protein somewhere. There's something going on inside of them. Another type that we'll see is where you have a decreased amount of Pcv and a decreased amount of total solids, and basically this is anemia, so there's a loss of blood as well as a loss of protein going on. Some other tests that you can run, you could try a BUN stick, a blood urea nitrogen stick. Basically, this can help tell if it's dehydrated. Lactate, you could run a lactate if they have an increased amount of lactate, which is an enzyme in their body or an electrolyte in their body. It may or may not mean that they're dehydrated. A urine-specific gravity, generally if it's higher, they tend to be, so basically if there is more solids, it's going to be plus or minus dehydration. So what I mean by that is if it's 1040, if it's a 1040, that's actually a lower amount of solids in the urine, where a 1015 is a higher amount of solids in the urine. Blood pressure, this kind of indicates tissue perfusion, may or may not show you that they have dehydration. It just kind of tells you what's going on inside. So there is a case study. I just want your opinion. I want you to be able to tell me if you think this patient is dehydrated or not. So it is a 9-year-old poodle. He has a history of not eating, of vomiting and diarrhea. His body weight is 29.7 kgs. His temperature is 40 degrees Celsius. Pulse is 210 with a strong, his heart rate is 210 with a strong pulse. He's panting. His mucous membrane are tacky. He has a CRT of about 2 seconds, of greater than 2 seconds. Less than 2 seconds. He has a skin tent of about 2 seconds. His PCV is 60. His total solids is 8.6. And he has a urine-specific gravity of 1015. So please let me know when you come into class if this patient is dehydrated.